Good morning, and thank you so much for joining us. My name is Patty Adams, and I'm the CEO of Scars of the Past Ministry, where we support sexual assault victims and survivors with a holistic approach. April is Sexual Assault Awareness Month, and this April 2024, we will be having some guests that will come and join us to focus on the theme Building Connected Communities. The theme was developed by the National Sexual Violence Resource Center. We have some very exciting guests, so stay tuned and continue to join us. Today, we have with us Ashley Hasson, who is the education specialist with the Crisis Center. Please welcome Ashley. Well, hello, Miss Ashley. How are you doing today?
Hi there, I'm doing well. How,
Good. Thank you so much for joining me.
absolutely, my pleasure.
Thank you. I appreciate that. Well, I also want to thank you for agreeing to do this interview because it's basically going to highlight you, but it also highlight the nonprofit slash agency that you work for. I am very passionate about survivors. I myself am a sexual assault survivor. So I'm always interested to find out what other agencies are doing to help victims and survivors. So before we get into anything, since you work with survivors, do they prefer being called victims or survivors?
Um, you know, I would say it's survivors. That's the preference. Yeah.
Thank you. Thank you. So I'll try to make sure that if I'm asking a question along the way, that I will use the term survivor.
Yeah.
Because for myself, it didn't bother me to be called either one because I have been a victim and now I'm a survivor. But I do know that some people get really kind of like on the fence about that. So we want to keep it politically correct here. So I
I
understand
love
that
your
you work
belief.
as a education specialist for the Crisis Center. Tell me a little bit about that. What do you do and how did you get involved with the Crisis Center?
Yes, so I am their education specialist and public speaker. And about a year and a half ago, I found this position and I love this work. I love giving to people and helping people and educating the community. It's where I get my joy and my light from. So,
I love that. I can tell because your light is already shining. And so they have the right person for the position. And that's just not fluff. That's me being sincere. It takes a special person,
awesome.
I believe, to do this type of work. And so let's see. So Crisis Center has been in existence for how many years you
We
think?
we are coming up on our 50th year. It'll
Wow.
be, I think, May or March is our 50th year.
Okay. And what's the mission statement? What do y'all stand by? What's your vision, your mission?
So our vision and mission, they're very similar, but I'll give you the gist. So
Okay.
we're here to help survivors of sexual assault to rebuild their hopes, dreams, and lives through advocacy and through partnerships we have with the community, through programs that we do here at our facilities, group sessions and things like that, and helping them through the system. So with like legal matters and honestly, just having someone to talk to who understands can help out a whole lot.
That
Um,
goes a long ways.
I kind of pittered out at the end there on our mission statement, but you got the whole of it.
Yes, of course. I have the gist of it. I just wanted something, short and simple, and you did that because I promised you that our interview wouldn't be very long today. In fact, I'm sitting here with my cup of coffee and my water and trying to decide on which one I want to drink first. Because otherwise, hey, I might not get through this interview. But anyway, that's a whole nother story. So are you yourself a survivor of sexual assault?
I'm not. I'm not. I just have a passion for the work. So at the Crisis Center, we also work with a plethora of other things like
Okay.
suicide
Mhm, mhm.
and mental health, and
Yes.
those are my topics that I'm very passionate about. That's one of my like things that brought me into this.
Very good. And I did check out the website and kind of went through some things. And I'll tell you firsthand that when our nation, I believe it was nationally that it happened, changed that long 1-800 from suicide or mental health to 988, I was
Yeah,
like jumping for joy. I have mental
yeah,
illness in my family. I've suffered with some mental depressions and things of myself. And I just thought and I've actually contemplated suicide because I'm a survivor. So I've been sexually assaulted 4 times, unfortunately, but I'm still here. So I'm okay. But I just thought if I'll never want to call or have to remember all these numbers if I was in a crisis situation. So to be able to just call 988 and actually get through to someone, that just blessed me greatly. And so do you get many calls through that line, coming through that line?
we do. We get. when they have an overflow, they'll send the people to our hotline. And we take care of them here. Yeah.
So overflow from where? Where are you getting your calls in from?
From 988. So if 988 has an influx,
Yes.
and the people are in our area, they'll send them to us because
Oh,
we
that's
connect them.
wonderful.
Yeah, we connect them with local resources. So like
Yes.
people like Spindletop,
Yes.
who can come out and actually help.
Mhm. That's very good. I'm very happy to hear that. And so, since you're also associated with probably NAMI, who is usually the National Mental Health Institute, you're probably also very familiar with RAIN, and I'm sure you probably get calls there for the on the sexual assault side. And
Yes.
so it just alarms me how much the numbers just keep going up. You know, according to RAIN, it's like every 68 seconds an American is sexually assaulted, and every 9 minutes it's a child. I'm part of that childhood sexual violence. And so how many, say, survivors do you think come through your agency, say in the last year, just a random number, would you say that you all were able to support through your efforts?
Just a rough guesstimate here.
Yes,
I'm
just a
going to
rough
say
guess.
around 300.
Wow,
Um,
that's a lot.
and I think reports are going up because education's happening and people are starting to
Yes,
understand, you know, this is something that's not supposed to happen,
right.
or you can speak up. There are people that will listen. And I think
I'm
that's
just
really
happy to know
important.
that they're reaching out because, there's a stigma that's associated with sexual abuse. And the biggest stigma I would say is that one, they're gonna believe me. And nobody doesn't don't want to be in a position to not be believed for what's going on with them. I know I didn't want to be in that position. So the fact that they have taken that first step and said, I'm going to get the help I need, that's a large number. I really didn't expect for it to be, even as a rough guesstimate, 300, because I feel like at this day and time, even coming through my agency, you can open up all these doors and tell people about all these agencies, survivors particularly, and they still won't take the step to come. And so, how is your agency getting the word out, or the agency you're employed for saying, we're available to help you? What do y'all do to get the word out?
So we do lots of different events, and we get out there and we speak to people. Last year, I was in high schools and colleges talking about sexual assault, being aware of what sexual assault is, um, and what leads to or what people can do to get out of that situation too. I think is really important because some people
Absolutely.
maybe they just don't feel comfortable talking about it to who they're around. So like having a person to call, like this hotline, just helps people out, and just making people aware
Right.
that other people have experienced this. You can come and talk to someone. I
Yes.
think there was such a stigma in our world around it that people just don't talk about it, but now we're starting to. I feel like it's becoming a conversation.
Yes, and that's good. My heart goes out to anyone who has suffered any type of abuse, whether it's domestic violence or sexual abuse, or, feeling like they want to commit suicide, whether it's based on mental illness or other things. It's a big deal. And I hope that more people will realize, like yourself and I, that it's a big deal and that these people need help. And sometimes they won't come to you. So knowing that y'all get out in the community and actually talk and say, hey, we're here, makes me so glad. I'm hoping to be part of that team now that I'm more or less new in Beaumont. I'm still trying to get familiarized with everyone. And so that's my goal, is to be one of those people that's out there helping in any way that I can. So what type of support do you get, say, from law enforcement and the, say, district attorney's office and other agencies that support you all? Because I'm sure they're gonna, they have legal cases and all these different things. What type of support do you think that you're getting from them? Do you think that they're on board with supporting you guys?
So we're actually partnered with the local law enforcement and also some of the government agencies. It's called a SART.
Yes.
We have a SART here in Beaumont, and that's how we're partnering with those agencies to come together and to really make a difference in our community.
I'm part
Um,
of the SART team, so I'm familiar with that. So for
yeah,
everyone who doesn't know who's listening, SART stands for Sexual Assault Response Team. And I
yes,
only do that because I worked as an accountant for years. And so everything was an acronym. And if you were talking to someone who was a non-accountant, they would just give you that kind of,
yes.
glare, like what in the world, what is AP?
It is a
What
SART.
is what is GAAP? Yes, exactly. And so I'm real big on making sure that everyone knows. And yes, I think that the SART team is doing a phenomenal job. I was happy to join them as a survivor because I think that if you're going to work and support that team of people, you need to know what they've gone through. And I would see it from different eyes than someone else who perhaps have not been through that type of abuse and that type of victimization. So I'm happy to know that
Absolutely.
they're supporting you all. And I heard through someone, let me see, who was it? You had an interview not too long ago. I think it was maybe January 2024, where you talked with the Jason with the NFP. It was a podcast.
Yes, I did. Yes.
Yes, yes, that was a good interview. Yes, I do my research. I'm not just going to interview
Awesome.
someone and not know anything about them. And it seems like you're very comfortable with interviews. Do you do a lot of different interviews to support the crisis center?
Yes, that's a part of my job as their public speaker. I've done quite a few over the past year. I've been more out there over this past year. I've done with local news stations and things like that too.
Oh, that's very good. I'm happy to hear that, very much so. So we talked about victims not wanting to be called victims. They would prefer to be called survivors. What do you think that transition is from them becoming, here's the victim, now I'm a survivor? What do you think that it takes for them to get to that next level?
You know, I think that's different for everyone. Just like you don't mind being called one or the other. I think there's other people out there that are the same way.
Okay.
I think it's just out of respect, if you don't know, to use that term survivor. I think that, I'm sorry, could you repeat your question for me?
You're perfectly fine. I was just saying that. What do you think the transition is
Oh,
from them getting
transition.
from being a victim to a survivor? Like I know for some it may take 2 weeks, some it may take 10 years. What do you think that transition period is? How do they get to the next level?
I think it takes support. I think it takes people around them being aware and um, it takes them healing, whatever that looks like for them. And
Yeah.
like you said, it could take 5, 10, 20 years even. Um, but at our agency here, we work with people for as long as they need.
That
So
so
a
confident to
survival,
know.
yeah. What?
I
I'm
was saying
sorry.
that's so confident to know that you all don't just
Yeah.
leave them hanging, that you work with them as long as they need.
And I think having support, I think we as people, we need that human connection and support. And I think that's really what gets people through things, no
Very
matter what it
much
is.
so yes,
Um,
I agree. Now you mentioned support. So does the Rape Crisis Center have support groups, weekly support groups?
we do. We have support groups, we have youth, adult, and we have them on different topics. So
Okay.
we have some for family members of survivors, we have some for survivors, adult and youth survivors. And then we have a variety of other groups that aren't necessarily about sexual assault too.
Okay. And then what nights, since we're on the subject of sexual assault, that's what this month is to bring awareness. What nights are those available? And is there a number they can call or is there a location? Sometimes locations are not published for obvious reasons. How
Right.
would they know where the support groups are and what days or nights they are offered?
So the way they would do that is to contact our office.
Okay.
Our and whether it's you could call our hotline. That
Mhm.
hotline number is 1-800-793-2273.
Okay.
And you'll connect with one of the advocates, and the advocates will get you that information based off your needs, if that
Thank you
makes
so
sense.
much for that information. Yes, and that number will be coming across our screen so that everyone can see it. I think that the last parts of it stands for We Care, and I
Yes.
love that it spells out We Care. So just in case you forget the number, you can just do the letters and you'll still arrive at the same place. And so thank you for that. I appreciate it. Also, I was looking at your website and I know that there are people that volunteer, and I'm sure one person can't do it. You have to have a big team of people that work with this. And one of the things is you have a lot of victim advocates that work with you guys. So I'm reading over all this information, and that was two things that kind of stuck out to me. One was that if someone wants to work with that team, they have to have a landline. Why would a landline be important?
You know, I don't know the answer to that question, honestly.
Okay.
I'm not sure why we would need a landline. I know that our advocates right now, I'm personally one of the advocates
Yes.
that answers the hotline.
Yes.
I have a cell phone, so
Okay.
maybe it's just that we need to update that information.
Well, and that was one of the reasons I asked that. And thank you for just being gentle
Yeah,
with me because none of this is to try to put anyone on the spot or make anyone look
no,
bad. So I'll say that for the
yeah,
record. But I just thought this is 2024. Why would anyone need a landline? But I understand because of privacy concerns and the rest. I think it would be tougher to try to find someone's personal cell phone number than it would to find their landline, number.
yeah,
But there has to be a reason. And so maybe it either needs to be updated or if it doesn't, then maybe you may want to put just a little more information as to why that's a requirement that someone
yeah.
has to have a landline. But that did kind of throw me. I was like, what? And then one of the other things is your hotline. It basically says it's from home. I guess the training is from home. So once you get trained from home to work the hotline, are you also able to work from home to
Yeah.
answer the hotline?
Yes, so our volunteers work from home.
Mhm.
Um, they usually have a schedule, and they get paid by, I believe, the calls they answer. So if you're a volunteer, you don't have to answer your calls, um, but it is greatly appreciated when you do.
Oh, that's something I may very much want to train for. I also saw that you had to have reliable transportation. And I take it, is that for if you have to take someone to get a SAAM test or anything of that nature,
Yes,
you're
so
required to do that?
that's for medical accompaniment,
Accompaniment,
and
yes.
and yes, they would need reliable transportation for that if they're volunteering for that side of it.
So also there's probably court accompaniment. Do you all accompany the survivors to court? And are you trained on what to do? Are you pretty much there just to listen and be there to make them feel comfortable? Or are you trained to handle specific tasks once you're there at the courts?
So I believe we're there as a support system for the survivor in the courts. Um, that's what we're there for, to be their support system, to be there for them. But we don't really get involved in the cases per se
Understood.
unless we're called to like testify.
Yes, yes, understood. So it seems like if I was going to envision your office, just based on what you're telling me and the community that you have what, like at least 300 people working there?
Um, we have 8 wonderful people right now working here.
Wow, that's amazing. And all of you all advocates, all 8 advocates?
We have a director, assistant director, and then yes, we're all trained advocates.
Wonderful, wonderful. And so, well, that's pretty much all the questions I have. I recognize that everyone's day can get super busy. So I try to be cognizant of that because people keep saying, well, you're retired, so you just don't understand. It's like, well, I haven't always been retired.
Oh, I've loved our conversation
Oh,
today.
I worked my butt
Uh,
off for years. And so I totally get that 100%. But, I'm so thankful for your time. And if you have any questions for me, I'm more than willing to answer anything you may have for me or share a little bit about our nonprofit and how we came to be.
well, if you'd like to share, I'd love to hear. Let me know a little bit more. Talk about it.
I will. So Scars of the Past has been in existence since 2017. And I was living in Crestview, Florida at the time. And let me tell you, Crestview, Florida does not nearly have the support that's here in
No.
Beaumont. And so when I got here, I was extremely happy to know that there were so many agencies that are coming together to support survivors because I was like, I'm in the right place. It was very hard for me in a sense that I felt like I was doing so much alone. Now, I had my board of directors, I had a great volunteer group of people that helped me. So we had support group meetings once a week. And one of the questions I'll ask you, you'll understand why when I tell you why, is that our agency supports both male and female. So I want to know from you, does your agency also support male and female?
We support any victim, any
Great,
survivor of sexual
great,
assault.
wonderful, because so many people are not supporting males and they get assaulted also, and they need the support also. And so it kind of disheartens me when I hear that, even though my assault was by men. So it was like, I'm not doing this. I felt like God gave me the vision to open up this organization and this ministry. But I really had an issue with that because I was kind of like, but I was assaulted by men. I didn't help them. And literally God was like, but they didn't assault you. The men that are needing help are not the ones that assaulted you. And so after me trying to run from it forever, I was just kind of like, okay, I'm going to do this. And so right now we don't have anyone coming through our agency. And part of it is because people don't know that we exist. And so, that's why I've been working with SART and trying to work with the community because I want them to know that, hey, we are a Christian holistic organization, ministry. And so we do help through that approach. That's not for everyone. But I
Wonderful.
always make sure that the survivors get the help wherever they need. You know, so we've had Jehovah Witnesses come through. We've had Buddhists that has come through, and I referred them out to agencies that they felt like that would be better equipped to work with them, because at the end of the day, I just want them to be helped. I don't care about your religion. I don't care about your race. I don't care about any of that. And so we have a great team of people. It was birthed out of me, I said earlier, being sexually assaulted 4 times. So I am extremely passionate about helping others. I don't want to see anyone have to suffer and go through it alone. And for me, for so many years, I felt like I was alone. Intellectually speaking, I knew I wasn't. I know what the stats say. I just got through quoting them a few minutes ago. But for me personally, I just felt like this is just me, and I'm not going to make it through this. I don't want to make it through this. And so from the bottom of my heart, I really do. I thank you. I thank you for all of the efforts at the Crisis Center. Please pass on my graciousness, that I'm grateful for the work that y'all do. It almost brings me to tears, so I apologize. I'm a big baby, but it is.
No, your
I
story
want
almost.
people to really know that it takes special people to do this type of work, whether or not you've been sexually assaulted or not. The fact that you're passionate to help someone like myself makes me very joyful. So thank you for your time. Thank you for coming for this meeting. And hey, we'll get together again. I don't know when it'll be, but I'm sure we'll get
Absolutely.
together again. So thank you
Absolutely.
again. You have a wonderful day. Stick around for a little while so we can chat.
Thank